Good morning. NJBIZ would like to welcome you to the 14th Annual Healthcare Heroes Award Ceremony. We are thrilled to have you joining us for this morning's virtual event. During our program, we will honor individuals and organizations that are making a significant impact on the quality of healthcare in New Jersey. We are ready to begin and hope you enjoy the program from the comfort of your homes and offices. And now, please give a warm virtual welcome as we introduce your host, Ken Casales, publisher of NJBIZ.
Good morning. I'm Ken Casales, publisher of NJBIZ, and I welcome you to the 14th Annual NJBIZ Healthcare Heroes Awards Program presented by Horizon Blue Cross Blue Shield of New Jersey. If anyone understands what an unsettling time the past 6 months has been, it's those of you joining us this morning, our healthcare heroes working on the front lines, behind the scenes, and around the clock to keep New Jerseyans safe. I hope that all of you and those whom you love and care about are also healthy and safe. I am so absolutely humbled to stand before you this morning. Let me say to you the same thing that I have told my ER nurse daughter many times. The great things you all do in a week pale in comparison to what I have done during my entire career. The stories she shares after her day at work don't exactly make me want to share how stressed I get about meeting certain financial goals. All I can say is thank you. Thank you so much for what you do, day in and day out. Thanking you is always appropriate, but it is especially resonant during these times. You are all true heroes, and I am so thrilled to recognize so many of you this morning. At this year's event, for the very first time, but definitely not the last, we are recognizing a Lifetime Achievement honoree. Our inaugural award will be given to the Commissioner of the New Jersey Department of Health, Judy Persicelli, who we will hear from later on in the presentation, with a special guest making her introduction. Although the coronavirus pandemic has kept us from coming together in person, as we traditionally do for this awards event, we are truly pleased to provide you with a special virtual awards program. This pivot to the virtual space allows us, and all of you, to safely celebrate and honor these amazing individuals and organizations that are making a significant impact on the quality of healthcare in New Jersey. And I think it goes without saying that this year's group of honorees is definitely doing that, and more. Since the COVID-19 pandemic began to impact our communities earlier this year, I've heard countless stories of healthcare workers going above and beyond to lift up their patients and colleagues. They did this in spite of the incredible stress that the pandemic inflicted on their lives and families. You will be hearing similar stories shortly about this year's group of healthcare heroes who epitomize the word hero for going above and beyond the call of duty to make the Garden State a healthier and safer place to live and work despite being faced with the overwhelming challenges of a pandemic. At NJBIZ, we want to make it clear to everyone working on the front lines in our communities, you are so appreciated and the work you're doing matters now more than ever. I really wish that I could see each of you in person this morning, but I am hoping that those of you who can join us are enjoying a well-deserved break from your hectic days. I encourage all of you to join the chat on the right-hand portion of your screen. This is where you can post comments and cheer on your colleagues, family, and friends. Please know that if you're viewing this on an iPad or another tablet or mobile device, you may need to click on those three dots in the upper right corner to request the desktop version, as that's where you'll see the chat. Before we jump into the awards, I'd like to thank our sponsors for helping make this event such a success. Each one shares the belief that while COVID-19 is keeping us from celebrating in person, it cannot and will not keep us from coming together. So let's give a big thank you to our presenting sponsor, Horizon Blue Cross Blue Shield of New Jersey, our major sponsors, Hackensack Meridian Health, New Jersey Hospital Association, and Atlantic Health System, our supporting sponsors, RWJ Barnabas Health and St. Joseph's Health, and our live chat sponsor, Englewood Health. Speaking of chat, I hope to see a lot of congratulatory messages on the right-hand side of the screen to all our honorees, as well as some heart emojis, healthy heart emojis, to our sponsors for their commitment to this program. And their commitment to this event is really unbelievable, and I would now like to spend a bit more time recognizing them. I would like to thank Englewood Health for being our live chat sponsor. Englewood Health is one of New Jersey's leading hospitals and healthcare networks, delivering nationally recognized care in a community setting to residents of northern New Jersey and beyond. Composed of Englewood Hospital, the Englewood Health Physician Network, and the Englewood Health Foundation, the health system consistently earns high marks for clinical excellence and patient safety. Thank you, Englewood Health. I would now like to recognize our supporting sponsors, beginning with RWJ Barnabas Health. RWJ Barnabas Health is the most comprehensive healthcare system in New Jersey with a service area that covers 9 counties and 5 million residents. RWJ Barnabas Health and Rutgers, the State University of New Jersey, through their public-private partnership, are jointly developing and operating a world-class academic health system. RWJ Barnabas Health is comprised of 11 acute care hospitals, including 5 teaching hospitals and an academic medical center, 3 children's hospitals, a nationally renowned pediatric rehabilitation hospital, and its network of outpatient centers, a freestanding behavioral health center, and the state's largest behavioral health network. Thank you, RWJ Barnabas Health. And our other supporting sponsor is St. Joseph's Health. St. Joseph's Health has proudly served the residents of New Jersey and the metropolitan area for over 152 years. Sponsored by the Sisters of Charity of St. Elizabeth, St. Joseph is a world-class healthcare network recognized for its innovative programs and cutting-edge services. The health system is supported by over 6,000 leading and renowned physicians, nurses, and care teams, and operates a full continuum of care, including St. Joseph's University Medical Center in Paterson, St. Joseph's Wayne Medical Center in Wayne, and St. Joseph's Healthcare and Rehab Center in Cedar Grove. Thank you to St. Joseph's Health. I would now like to recognize our major sponsors, beginning with Hackensack Meridian Health. Hackensack Meridian Health is a leading not-for-profit healthcare organization that is the most comprehensive and truly integrated healthcare network in New Jersey, offering a complete range of medical services, innovative research, and life-enhancing care. The network comprises 17 hospitals from Bergen to Ocean counties, including 3 academic medical centers, 2 children's hospitals, 9 community hospitals, 2 rehabilitation hospitals, and a behavioral health hospital. The network has more than 500 patient care locations throughout the state. Hackensack Meridian School of Medicine, the first private medical school in New Jersey in more than 50 years, welcomed its first class in 2018. Additionally, the network partnered with Memorial Sloan Kettering Cancer Center to find more cures for cancer faster while ensuring that patients have access to the highest quality, most individualized cancer care when and where they need it. Hackensack Meridian Health's John Thorough Cancer Center is part of the Georgetown Lombardi Comprehensive Cancer Center Consortium and is one of only 16 in the U.S. approved by the National Cancer Institute.
When you can repair a mitral valve instead of just replacing it, you can replace open heart surgery with a small incision. And the shorter recovery times do more than change the course of medicine. They change the course of lives. And that's something we will never stop trying to make even better. New Jersey's most successful minimally invasive heart surgery is at Hackensack Meridian Health. Keep getting better.
Thank you, Hackensack Meridian Health. Our next major sponsor is New Jersey Hospital Association. New Jersey Hospital Association is the state's oldest and largest healthcare trade association. Its 400-plus members span hospitals, health systems, nursing homes, home health, hospice, medical daycare, pay sites, and others devoted to improving the health of the people of New Jersey. Each year, but especially this year, NJHA is grateful to the healthcare heroes who are always here to care.
A healthier New Jersey. That's the goal for NJHA and our 400 members.
Thank you to New Jersey Hospital Association. Our final major sponsor is Atlantic Health System. Atlantic Health System is at the forefront of medicine, setting standards for quality healthcare in New Jersey, Pennsylvania, and the New York metropolitan area. Powered by a workforce of more than 17,000 team members and 4,800 affiliated physicians dedicated to building healthier communities, the system offers more than 400 sites of care, including 7 award-winning hospitals. Atlantic Medical Group, comprised of 1,000 physicians and advanced practice providers, represents one of the largest multi-specialty practices in New Jersey.
People ask me what it's like to work in healthcare during a global pandemic. Let me tell you what I see. I see heroes. I see colleagues collaborating and innovating to be at the forefront of care. Thank you to the heroes of Atlantic Health System and beyond.
Thank you, Atlantic Health System. And now, I'd like to introduce the presenting sponsor of the 2020 Healthcare Heroes Awards. Horizon Blue Cross Blue Shield of New Jersey, a very special partner with us on this event. Horizon Blue Cross Blue Shield of New Jersey is a tax-paying, not-for-profit health service corporation providing a wide array of medical, dental, vision, and prescription insurance products and services. Horizon Blue Cross Blue Shield of New Jersey is leading the transformation of healthcare in New Jersey by working with doctors and hospitals to deliver innovative, patient-centered programs that reward the quality, not quantity, of care patients receive. Horizon Blue Cross Blue Shield of New Jersey is an independent licensee of the Blue Cross and Blue Shield Association, serving approximately 3.5 million members.
In uncertain times, you need someone who has your back. That's why at Horizon Blue Cross Blue Shield of New Jersey, we make sure our health plans have all the benefits you need. More ways to get care virtually. More support for your mental health, too. More tools on your phone. All in a range of health plans so you and your family can find just what you need. And we can help, because everyone should feel like someone has their back, not just in uncertain times, all the time.
Joining us this morning from Horizon Blue Cross Blue Shield of New Jersey is Alan Karp, Executive Vice President, Healthcare and Transformation Management.
Good morning. It's my privilege to be here again with you to represent Horizon and celebrate the accomplishments of New Jersey's healthcare heroes. Although we are connecting virtually this year, the power of your success stories is as strong as ever. This year, Healthcare Heroes has a deeper meaning. There are no words that can truly express our appreciation to all of those who work in healthcare and the sacrifices you make for your patients. Now more than ever, your work and dedication is recognized and applauded. Thank you to NJBIZ for giving us the opportunity to support this program. Horizon has been committed to improving the quality of care in New Jersey for more than 88 years. While most of us were able to shelter at home with our families, many of you were on the front lines, risking your health and putting your families at risk to help your patients. As healthcare workers, you are facing a healthcare crisis that most of us have not seen in our lifetime. And you continue to care for your patients to ensure that they get the care and the help that they need. Your dedication to helping others during these challenging times is truly heroic. And I am sure I can speak for everyone when I say thank you. This event gives us an opportunity to recognize your work and be there for you. You are all winners. Thank you very much.
I'm Miles, and this is what I work for. To be my best for them and for me, in body and in mind. I need a health insurer that helps me get the care I need for both, that has mental health professionals that I can talk to when I need to, because when I feel strong and secure, so do they. This is my life. And this is how Horizon Blue Cross Blue Shield of New Jersey works for me.
Thank you, Alan, and Horizon Blue Cross Blue Shield of New Jersey for being such an important part of this event for so many years. Thank you to all of our sponsors. We greatly appreciate all of your support. Another group that contributed to the success of this program is our independent panel of judges, which this year include Dean J. Paranicus, President and CEO of the Healthcare Institute of New Jersey, Judith Schmidt, CEO of the New Jersey State Nurses Association, Deborah Viscani, President and CEO of New Bridge Medical Center, and Jay Cedar Wang, Vice President of Nursing at Holy Name Medical Center. This year, our judges had an extremely difficult task before them. Our 2020 nomination pool was full of extremely qualified professionals and organizations. Not to say that we don't get an impressive group every year, but this year was extraordinary. After receiving the judges' final scores, we narrowed down the list to today's finalists, and then we said to ourselves, wait a second, we are living in unprecedented times, and during these times, unprecedented things happen. And one of those things is gonna happen today, this morning, very shortly, like right about now. The year of 2020, the year of COVID, the year of living our lives in a way that we could never have imagined, is the year we felt it not right to differentiate finalists and winners in our 2020 Healthcare Heroes event. So this morning, all of our finalists are winners, and all of the winners are heroes. New Jersey's heroes, our heroes. And I couldn't be more proud of what we do at NJBIZ than I am right now. I'm sure you will agree with us that this decision was the only decision given the world we all live in today. Now let's get on with the program and meet New Jersey's dedicated and amazing healthcare heroes.
For me, the silver linings of this pandemic were the resiliency of our doctors, nurses, and respiratory therapists, watching my nursing team step in as surrogate family members for COVID patients who were battling this illness without family members by their side, and the outpouring of community support that let us know we had so many people cheering for us.
And you stepped outside on the sidewalk, you saw how the kids in the neighborhood came and painted rocks and made motivational signs for everyone. It was amazing how the entire community responded and aligned to this event.
The support that we received from them was absolutely incredible, and the resilience of our healthcare workers. They inspired me every day.
We pulled together so quickly to help those in need, and we're very proud of that.
It was putting all of our skill set together. It was working as one, as a single unit.
We could not have done our job without the incredible leadership from above and the incredible work from all my healthcare colleagues.
Administrators, physicians, nurses, respiratory therapists, ancillary staff to take care of not only the patient, but also their families.
They've done everything to help save and heal our elders, to support them and to support one another.
COVID-19 has only accelerated our commitment to workplace wellness initiatives, whether in the office or not.
In order to foster the highest level of well-being, we need to embrace the diversity of our team and to continue creating an environment where all people feel included and comfortable bringing their whole and best selves to work every day.
We need to remember that we have given a gift of life to learn and appreciate ourselves and everything around us.
Our life is short and we don't know what's going to happen tomorrow, so we need to try to live our life to fullest extent.
Know thy neighbor, because you never know when that opportunity will come for you to collaborate and create something amazing.
We can truly come together, and through teamwork and collaboration, we can support each other and achieve more.
Since the pandemic, there's not been any doubt in anyone's mind that we're all in this together.
Active listening, empathy, and genuine compassion for our colleagues builds pandemic resiliency.
Due to our tireless efforts and devotion to nursing, we have been united by trial and emerged better than ever.
This pandemic has highlighted how academic science can play a critical role in helping the medical establishment in real time confront disease challenges and save lives.
Our students who were so disappointed when we had to take them off the wards for lack of PPE, until they discovered that there was so much they could do from behind the scenes. They learned that through adequate reviews of the literature, they could update the front teams that were there and could make a real difference.
Creativity has really powered me through the pandemic, through my work life, through my home life, social life, and so I have used my ability to be creative to really be successful.
To adopt telemedicine and really an embrace of telemedicine as a result of the pandemic, and being able to narrow that wait time down to under a week has just been a proud moment, but that only happened because of the pandemic.
This past few months has helped me grow and build my leadership skills and helped me come closer to my coworkers. It is great to see how we all pull together to assist our residents.
Keeping providers connected in a timely and efficient way has really made an impact in healthcare. We're all in this together. Stay connected and let's start collaborating.
Our first group being honored is our Education Heroes. These individuals and organizations are being recognized for spreading the word about health education and by making a difference in their community and in healthcare. Here are the individuals being honored. Having already achieved a long-standing commitment to medical education, the residency program at St. Peter's University Hospital has risen to new heights thanks to Dr. William Bernstein, a respected pediatrician at the hospital for 28 years. Although still new to his role as the Pediatric Residency Program Director when the pandemic hit, Dr. Bernstein went above and beyond to keep residents updated on the ever-changing status of incoming patients and treatment protocols while continuing to expand innovative learning opportunities. It is truly rewarding to see a resident grow into a confident pediatrician, graduate, and go on to have a positive impact on their patients and on society, says Dr. Bernstein. Dr. William Bernstein. A true champion for innovation in healthcare education at Newark Beth Israel Medical Center for more than 20 years, Mary Koch currently serves as Director of Nursing Education. My proudest achievement is impacting every person I teach so that they can safely care for our patients, says Koch, who after training hundreds of nurses in preparation for the medical center's incoming COVID-19 patients, contracted the deadly virus herself. After a week as an inpatient, she now uses her own experience as a patient to teach students the powerful impact that nurses and healthcare professionals have in the journey to healing. Mary Koch. As the talent management and diversity partner at Atlanticare, Christian Ragland creates recruitment strategies and pipelines for jobs in healthcare. He has spent hours in his community educating those who have an interest in working in healthcare. He has also been invited to speak to numerous schools and community organizations about career readiness and healthcare opportunities. Although COVID-19 created some roadblocks to educating people in person, it didn't stop Ragland. Instead, he created a platform on Facebook called Christian's Classroom, where he discusses through live videos the various facets of healthcare careers as well as job readiness tips. Christian Ragland. In addition to serving as a vascular surgeon at Overlook Medical Center, Dr. Clifford Sales also founded the Overlook Summer Internship Program, which this year welcomed its 11th group of students. Serving as director of the internship program, Dr. Sales leads it in giving pre-med students a rare window into the numerous specialties they can pursue in a medical career through close-up, real-time observation of clinicians. The most rewarding part of my role is when students whom we have mentored contact us years later, thanking us for pointing them in the right direction and saying the experience changed their lives, says Dr. Sales. Dr. Clifford Sales. Serving as Associate Dean at Fairleigh Dickinson University, Dr. Chadwin Sandifer has been instrumental in constructing the educational environments within the school. With one of his main focuses being community engagement and service, he has devoted remarkable time and energy to developing opportunities for students to gain deeper understanding and appreciation for those who may be marginalized or in need of assistance. Knowing that, thanks to our program, caring, empathetic, and dedicated individuals are joining the healthcare profession and continuing to serve the New Jersey community makes me proud, says Dr. Sandifer. Dr. Chadwin Sandifer. And now, introducing the organizations being honored in our Education Hero category. As COVID-19 spread throughout the region, Atlantic Medical Group realized it would need to adapt to safely meet the imminent health needs of patients. When restrictions on telehealth services were lifted in March, allowing physicians to utilize any electronic platform to see patients remotely, Atlantic Medical Group's training and development team immediately began researching secure and reliable options. Thanks to their efforts, physician visits went from 0 telehealth visits to over 80% in a matter of days. In addition to providing technical support to physicians, the training team also developed educational tip sheets and training videos for patients in both English and Spanish. Atlantic Medical Group, Training and Development. Recognizing that the social determinants of health education, such as housing and access to food and clothing, are every bit as important to health outcomes as medical care, Hackensack Meridian School of Medicine recently introduced the Human Dimension course, which in addition to classroom-based activities and small group mentorship with a faculty mentor, matches medical students with families in the community. For example, while a student is learning anatomy of the heart and risk factors for cardiovascular disease in class, they are able to review health histories with their families. Since its launch, nearly 150 families and 80 community partners have been touched by the program. Hackensack Meridian School of Medicine. Next up is our Innovation Hero category, which recognizes individuals and companies for innovations in healthcare, ranging from medical science discoveries to new program or treatment developments that are saving lives or improving quality of life. Here are the individuals being honored. With more than 20 years' experience as a medical oncologist, Dr. Michelle Donato serves as Chief of Stem Cell Transplantation and Cellular Therapy at the John Theurer Cancer Center at Hackensack University Medical Center. As COVID-19 took hold of the Garden State, Dr. Donato saw an opportunity to apply her expertise, launching one of the nation's first clinical trials assessing the use of convalescent plasma from other people who had recovered from the virus to help others fight off the infection. Thanks to her leadership, this study has contributed to the knowledge of how the virus behaves and what is needed to fight it. Dr. Michelle Donato. As a surgeon specializing in pancreatic disease, Dr. Cataldo Doria is recognized for pioneering new techniques to treat conditions that were once considered untreatable. Currently serving as the medical director at Capitol Health Cancer Center, he has taken a major step forward in the fight against cancer by introducing the robotic-assisted Whipple procedure to treat patients with pancreatic cancer diagnoses in central New Jersey and the greater Philadelphia region. According to Dr. Doria, giving patients back to their families and re-establishing a new normal life for them after a complex journey is the most rewarding part of his job. Dr. Cataldo Doria. With more than 20 years of global drug development experience focused on infectious diseases, oncology, and pediatrics, Dr. Patrick Smith serves as Senior Vice President at Certara, a global leader in biosimulation. Currently, Dr. Smith and his team are supporting more than 20 COVID-19 clinical research programs. Working every day with brilliant colleagues from around the world who share an incredible sense of passion, urgency, and dedication towards making a difference in the lives of patients is the most meaningful part of my job, he says. Dr. Patrick Smith. Passionate about expanding patient access to clinical trials, Mike Wenger recently accepted the role as Vice President of Patient Engagement with TrialScope, a global leader in clinical trial disclosure management. Using his skills as a software developer, he is spearheading TrialScope Connect, a first-of-its-kind collective that powers smarter, simpler patient referrals for clinical trials. Already, Wenger has built relationships with dozens of nonprofit organizations and recruitment companies to form a patient referral collective based on an industry-first model that focuses on collaboration, not competition. To date, more than 50 referral partners have joined the network. Mike Wenger. And now, introducing the organizations being honored in our Innovation Hero category. As the world seeks effective treatments and a vaccine against COVID-19, Atlantic Health System turned to its Atlantic Center for Research for answers. Within the first weeks of the pandemic peak in New Jersey, the center developed the COVID Research Program to assist in finding a treatment that will either aid in symptom reduction or help develop a cure. With help and input from every level of the health system, the COVID Research Program has soared to one that is equal to top academic medical centers, having since opened 15 clinical trials and enrolled more than 150 patients. Atlantic Center for Research. Following the admission of its first COVID-19 positive patient in March, Holy Name Medical Center quickly became the epicenter of the state's outbreak, with inpatient census doubling every 4 days to a peak of 251 inpatients and thousands of virus-positive patients being monitored in their homes with telemedicine. As a result, Holy Name launched a massive crisis response and management effort to confront unprecedented challenges, which resulted in a remarkable safety record to treat patients and to protect staff and patients. Thanks to these efforts, less than 10% of employees tested for COVID tested positive, and after the building of 5 new ICUs, not one employee tested positive. Holy Name Medical Center. Focused on improving the patient experience and population health while reducing the cost of healthcare through innovation and technology, New Jersey Innovation Institute's Healthcare Division is revolutionizing healthcare through data-driven transformation. Serving as an advisory services organization within the Institute, the Healthcare Division works with a wide range of healthcare entities, including hospitals, clinical practices, behavioral health organizations, long-term care facilities, and many others. In the last 5 years, it has earned more than $120 million in government grants to manage large-scale transformation and interoperability projects. New Jersey Innovation Institute. Also recognizing companies for their innovations, our next category, Medical Technology Pioneer, honors companies that developed a technology that had a great impact on the public health of New Jersey. Let's give it up for the following honorees. The Hackensack Meridian Center for Discovery and Innovation was founded in 2019 to fill unmet medical gaps in oncology and infectious diseases and to rapidly translate science to address clinical urgency. Less than a year later, the country was swept by COVID-19 and the center's scientists embraced the challenge, rapidly mobilizing to develop essential diagnostics, study the biology of the virus, and discover and develop novel drug candidates. Among its breakthroughs included a rapid viral testing that has since been used to diagnose more than 4,000 patients during the pandemic. Hackensack Meridian Center for Discovery and Innovation. As a global healthcare fintech company specializing in contactless commerce payment solutions, MapPay LLC is leading the way for healthcare heroes, hospital systems, independent practices, and consumers by providing non-contact payment solutions for key transactions, such as telehealth appointments and pharmacy deliveries. Due to increased volume and multi-party transactions created by COVID-19, current systems and processes are not able to handle commerce in an efficient, compliant, and consumer-responsible manner. MapPay's secure solution minimizes risk and seamlessly integrates into any existing infrastructure. MapPay LLC. As the creator of the X2MR glasses, a lightweight all-in-one hardware and software augmented reality solution, Third Eye Gen saw an increased need due to the pandemic to better protect first responders on the job through high-tech solutions. As a result, it adapted its glasses to the needs of the healthcare industry and began supplying them to frontline personnel teams across the United States. The glasses help these professionals consult medics remotely via telehealth and detect fevers with an attached thermal sensor. The glasses not only increase efficiency, but also enhance protection of EMS teams and firefighters amid the pandemic. Third Eye Gen. Our next category, Public Health Hero, honors individuals who have made or are making an extraordinary impact on the public health of their community. Here are our honorees. Since joining Community Options Incorporated in 2012 as a direct support professional, Catherine Bryant has progressively grown within the organization, serving today as its executive director. Recognized as an exceptional leader, her strength showed especially during the COVID-19 pandemic while managing 14 group homes throughout Middlesex and Monmouth counties that house individuals with intellectual and developmental disabilities. Beginning in March, the pandemic hit close to home, infecting 12 individuals living throughout her homes. Taking the time to educate herself and answer staff's concerns, she has ensured a critical level of security and stability during an extremely destabilizing and confusing time. Catherine Bryant. Passionate about public health, Elizabeth Litton has spent more than 2 decades working with New Jersey healthcare providers, researchers, and public health entities to facilitate secure sharing of health information to promote wellness and improve patient outcomes across the state, especially underserved communities. As the Chief Privacy Officer in Fox Rothschild's health law practice, she is knowledgeable in both health and data privacy law. My clients are in the business of taking care of people, says Litton. I take great satisfaction in removing the obstacles that get in their way, allowing them to focus on what they do best, improving patient health and healing the sick. Elizabeth Litton. As founder and CEO of KinderSmile Foundation, Dr. Nicole McGrath Barnes is passionate about providing oral education and access to oral care to low-income families as well as expectant and new mothers, uninsured children, and the special needs population. In 2016, she opened a brick-and-mortar office in Bloomfield where patients in the community can receive quality, affordable dental services in a culturally sensitive environment. According to Dr. McGrath Barnes, her proudest achievement is being used as a vessel to increase access to oral care and education to over 25,000 children and families in the state of New Jersey and 8 developing third world countries in the last 13 years. Dr. Nicole McGrath Barnes. It was all hands on deck when Holy Name Medical Center was hit with a surge in COVID-19 cases beginning in March. Serving as the hospital's manager of quality outcomes, Angelica Mercado smoothly navigated a sea of change throughout the medical center, managing ever-changing clinical protocols, physical plant alterations, and technological upgrades. As a nurse, she found herself serving not only as a caregiver to critically ill patients in isolation, but also as their family, as visitors were barred from the medical center. I am most proud of the human connections I have made over the years, which have allowed me to leave my footprint in the world, says Mercado. Angelica Mercado. Serving as University Hospital's Chief Strategic Integration and Health Equity Officer, Dr. Chris T. Purnell helps lead the institution towards fulfilling its mission of serving the greater Newark area through a community-focused approach to healthcare. In the midst of the COVID-19 pandemic, the hospital saw the beginnings of a second public health crisis, as fear was dissuading people from getting non-COVID-19 related emergency care. In response, Dr. Purnell led the Care Around the Clock initiative, designed to remind individuals and families that the hospital was still open and providing quality care and services 24/7, and to stress the importance of continued access to health care for non-COVID-19 concerns. In addition to the COVID-19 pandemic, the U.S. continues to face another pandemic, the opioid and substance use disorder crisis. Serving as a recovery specialist with the support team for addiction recovery program at RWJ Barnabas Health Institute for Prevention and Recovery, Clement Perry focuses on addressing the disease of substance use disorder, which is currently being accentuated by the added trauma, isolation, and barriers to care brought on by the current pandemic. In response, Perry was instrumental in launching and hosting virtual all recovery support meetings, expanding them to 2 meetings a day, 7 days a week. Clement Perry. Since joining Atlantic Health System as Vice President of Integrated Care, Carol Vargas has been tasked with redesigning and restructuring existing teams, processes, and technology across the system's hospitals, medical groups, and service lines. Through her ability to create collaborative relationships with colleagues and external partners, and her comfort in implementing disruptive solutions, Vargas has successfully dissolved the barriers between entities and reorganized the work and teams under one streamlined, centralized, integrated care department that serves as the system's backbone for caring for the communities it serves. Carol Vargas. Our next category, Long-Term Care Facility of the Year, honors facilities that provide exemplary, innovative care for their residents and patients. Here are our honorees. Children's Specialized Hospital is recognized as the nation's leading provider of inpatient, outpatient, and long-term care for children from birth to 21 years of age facing special health challenges. Located at 13 different locations throughout New Jersey, the hospital's pediatric specialists partner with families to make its many innovative therapies and medical treatments more personalized and effective so each child can reach their full potential. For patients facing a terminal illness, the team goes above and beyond, demonstrating an unwavering commitment to making their last days as comfortable and peaceful as possible. Children's Specialized Hospital. As an organization driven every day to be the leader in creating a culture that exemplifies commitment, excellence, and the true meaning of family for its elders, the Jewish Home Family embodies innovation. Over the years, it has demonstrated innovation in reducing social isolation, creating community, and advancing the art of living not only within its walls, but within the community as well. One example of this is the Jewish Home at Rockley's creation of a nationally recognized Parkinson's program that includes support groups and fun activities. Faced with the pandemic, the Jewish Home acquired the necessary technology to launch the program virtually and to keep residents connected. Jewish Home at Rockley. Meadow Lakes, a Spring Point community, is a continuing care retirement community serving a large senior population, from independent living, assisted living, healthcare, and memory care. It has always been a close-knit community, but never so much as when it was struck with COVID-19. However, Meadow Lake's staff members found strength together as a team, helping residents to self-isolate comfortably and safely, while providing care and recovery to those residents afflicted with the virus. With all resident activities, events, and programs canceled, the team quickly switched gears to provide residents with alternative activities that they could do in the comfort and safety of their rooms. Meadow Lakes, a Spring Point community.
My proudest professional moment was watching the healthcare workers here at St. Peter's come together during the pandemic. The way that they took care of their patients and their patients' family was something that I will always remember. And not only did they take excellent care of their patients, they took such excellent care of each other. They really made sure that each other was supported and well taken care of. And I'm so proud of my staff here at St. Peter's University Hospital.
My proudest moment was also my toughest moment. As soon as COVID hit, I watched the doctors, nurses, and all the supporting staff here at Englewood not only do their job, but do whatever it took to take care of the patients under our care. None of us signed up for a crisis like this, but when it occurred, we rose to the occasion and took care of everyone in our hospital. Other leaders can say the same thing, I'm sure, but I've never been more proud to be a member of the Englewood team.
My proudest moment is seeing how our health system and medical group came together as a team and in so many ways met the challenge of the COVID-19 pandemic, demonstrating our core values, mission, and purpose in healthcare.
I'm most proud of the amazing family that my wife and I have been able to build. I have the privilege of working with one of the most exceptional teams I've ever known. In healthcare, these things are frontline caregiver dilemmas, and we have phenomenal frontline caregivers.
The highlight of my career has been working with 33,000 remarkable, extraordinary people who took care of more than 10,000 COVID patients during the pandemic, and leading them and working with them has just been the honor of my life.
We're about halfway through the program, and I'm sure you will agree that the individuals and organizations recognized so far are truly amazing, and the rest will be equally as impressive. I will go out on a limb and speak for everybody when I say thank you to these organizations that make such a difference in so many lives, and for all of the individuals for making the career choices they have made. Also, being a cancer survivor myself who was diagnosed, treated, and cared for in New Jersey means my gratitude goes far beyond thanking you for devoting your time and energy to the safety and health of New Jerseyans, but also a thank you to an industry that literally saved my life. I really thank you from the bottom of my heart. Now let's get back to honoring the rest of the 2020 NJBIZ Healthcare Heroes.
Up next, our Workplace Wellness category recognizes businesses that have implemented a company-wide wellness program, healthy work environment, ergonomics program, or other health-related activities benefiting employees. And the honorees are: led by CEO Chris Sullins, Central Reach has worked hard to enhance its health and financial wellness offerings for employees. In the last 2 years, the organization has improved its overall benefits package and increased PTO, also adding a free PTO for employees to use to volunteer within the community. When COVID hit, Sullins made the decision to close Central Reach's offices prior to the state mandate to keep employees home and safe from the virus that was rapidly spreading through the state. Recognizing the importance of employees' mental well-being, especially during these times, he introduced an employee assistance program and free mental health resources shared monthly in the company newsletter. Central Reach. Hackensack Meridian Health's Employee Wellness Program, led by Chief Wellness Officer Dr. Amy Fryman, was built on the knowledge that healthcare workers lead demanding, stressful, and at times even dangerous lives. Accordingly, Dr. Fryman constructed a program of on-the-job support for team members that are as varied, innovative, and accessible as any to be found in the industry, and that was before the onset of COVID-19. With more team members than ever dealing with anxiety, fear, depression, and exhaustion due to the pandemic, the wellness program has broadened its efforts, launching virtual support groups and free counseling for employees and their families. Hackensack Meridian Health. Next is our Volunteer of the Year category, which honors individuals who contribute time or expertise to patients or healthcare issues and whose volunteer efforts have made a significant positive impact on the community. Here are our honorees. A longtime volunteer of Denville Township, Michael Anderson went above and beyond when COVID-19 hit the community to launch an effort called Denville Strong. Under his leadership, the initiative has raised more than $42,000 to buy food, goods, and gifts from local small businesses in town, which in turn were donated to frontline workers and community members of Denville. Anderson also gathered almost 50 Denville community volunteers and arranged a volunteer grocery shopping program for seniors who could not go to the grocery store during the pandemic. The most satisfying moment of my volunteer work was knowing that we were helping our most vulnerable citizens, says Anderson. Michael Anderson. Dr. Gene Napoliello, or Dr. Gene as he's affectionately known, is a familiar face at many long-standing Delta Dental of New Jersey Foundation events where he dedicates countless hours to providing dental care to children, seniors, and veterans while simultaneously helping them find a dental home where they can receive routine dental care. He also serves as the current trustee and board chairman of the foundation, echoing its belief that everyone deserves a happy smile. Having served in the U.S. Air Force Dental Corps during the Vietnam War, Dr. Gene has been practicing dentistry since 1972, first at his own practice and now in a volunteer capacity. Dr. Gene Napoliello. As founder and chief medical officer of the Cherry Hill Free Clinic, Dr. Jubril Oyeyemi has taken the notion of a volunteer to a whole new level. Although he has a demanding full-time job at Virtua Memorial Hospital in Mount Holly, he launched the Cherry Hill Free Clinic 3 years ago, where he leads a team of volunteer clinicians in providing free care at the clinic, providing high-quality primary care with access to lab services, radiology, and specialists. More recently, he has led his team in adapting their care delivery model by embracing telemedicine in order to keep people safe during the COVID-19 pandemic. Dr. Jubril Oyeyemi. Our next category is Nurse of the Year, which recognizes individuals for their contributions to the nursing profession and the field of healthcare, as well as the positive difference that they have made in the lives of their colleagues, patients, and the community. These are our honorees. When Holy Name Medical Center gained national attention as the epicenter of New Jersey's COVID-19 outbreak, Dr. Michelle Acito immediately emerged as a key player in the hospital's crisis management and response efforts. Serving as Director of Nursing Operations at the time, she simultaneously handled an unprecedented patient surge and critical staffing shortages, all while enduring personal tragedy when her 89-year-old mother-in-law passed away from COVID-19. Recently promoted to Chief Nursing Officer, Dr. Acito is now leading the hospital's efforts to improve safety, enhance quality, and streamline best practices. A well-respected nurse leader and transgender rights advocate, Jackie Barris currently serves as the LGBT Health Navigator at Robert Wood Johnson University Hospital. A recipient of numerous awards in leadership, community outreach, and scholarship, she established the first LGBT hospital-based primary care clinic in New Jersey called Proud Family Health and founded the first transgender family support group, both located at RWJ Somerset. Every single day, I am able to teach people how to be resilient and strong, and that in the midst of any challenges and trials in their lives, there is a rainbow that awaits them, says Barris in regards to what she enjoys most about her job. Jackie Barris. During the COVID-19 pandemic, hospitals were forced to repurpose many treatment areas for COVID-19 care. At St. Peter's University Hospital, this monumental task was taken on by Dr. Sharon Haskins, Director of Medical Surgical, Critical Care, Physical Medicine and Rehabilitation, and Clinical Operations. Armed with the unique ability to see the big picture during a crisis and quickly read situations to determine solutions, she supervised multiple departments and their personnel, making sure workflow went smoothly while also ensuring the survival of patients and the safety of staff. According to Dr. Haskins, being able to mentor, support, and promote growth for staff and peers is the most rewarding part of her job. Dr. Sharon Haskins. From the moment Sorka Hicks heard that Overlook Medical Center needed to reorganize its nursing units to manage the surge of COVID-19 patients, she led with skill, determination, clear decision-making, and accountability. In her role as nurse manager, she was able to process multiple variables, make effective decisions, and then lead the implementation of changes. Throughout the pandemic, she visited patients at end of life, followed up with grieving families, and bolstered the confidence, courage, and clinical skills of the nursing staff. It was a privilege to work during this time as we managed this crisis and provided our community with the care they needed, says Hicks. Sorka Hicks. As the manager of nursing services at the Rescue Mission of Trenton, Marina Marish brings unwavering commitment, knowledge, professionalism, and compassion to each of the 91 individuals she cares for within the mission's residential addiction treatment program. For most of her patients, their only encounter with a medical professional was while incarcerated. Offering her undivided attention, she compassionately connects with each patient about their concerns, while also clearly conveying what they need to do to take better care of themselves. I believe that physical health is a critical piece to one's addiction recovery, and I love being part of that journey, says Marish. Marina Marish. Since beginning her nursing career at Morristown Medical Center 15 years ago, Kristen Ospina has demonstrated her commitment and leadership skills by consistently performing at the highest level. Serving today as the Director of Nursing for Critical Care, she is widely recognized as a leader and role model among hospital leadership, her peers, and those she manages. This was especially evident during COVID-19, as she diligently planned innovative ways to manage staffing and patient needs for critical care. The most meaningful part of my job is supporting and mentoring our frontline team to ensure they have the tools and resources they need to provide extraordinary caring, says Ospina. Kristen Ospina. For as long as Michelle Zucconi can remember, she had wanted to be a nurse. Looking back over her 30-year career at Inspira Health as a critical care nurse, she can't imagine doing anything else. Since joining the health system, she has expanded its critical care services to offer multiple new life-saving services. Currently under her leadership as the Administrative Director for Critical Care, all 7 critical care units have earned recognition from the American Association of Critical Care Nurses as beacons of best practice. According to Zucconi, the most meaningful part of her job is seeing the results that collaboration and shared vision can produce. Michelle Zucconi. Next up, the Physician of the Year category recognizes physicians who consistently achieve high standards in the practice of medicine and are looked upon as a role model by their peers. Here are this year's honorees. With a distinguished clinical background in obstetrics and gynecology and a proven track record of excellence in hospital leadership, Dr. John F. Bonamo serves as Executive Vice President and Chief Medical and Quality Officer at RWJ-Barnabas Health. In 2016, when Barnabas Health and Robert Wood Johnson Health System merged to form RWJ-Barnabas Health, Dr. Bonamo spearheaded the integration of each hospital to transform care across the combined facilities, and today continues to drive transformation. Most recently, his heroic leadership of the RWJ's system-wide response to the pandemic was key to its success in keeping staff safe and returning COVID-19 patients to their families. Dr. John F. Bonamo. With a more than 20-year career at St. Peter's University Hospital, Dr. Amar Bukhari currently serves as Chief of the Division of Pulmonary, Critical Care, and Sleep Medicine. His experience came to light in the recent pandemic as it allowed him to help coordinate a collaborative response at the hospital. Recognizing it would take a village to care for COVID-19 patients, he led the assembly of COVID physician teams that included infectious disease specialists, primary care physicians, pulmonologists, and medical residents. His foresight to see the situation as fluid led to a comprehensive approach that exhibited medical leadership at its best. Dr. Amar Bukhari.
Congratulations to Dr. Bill Bernstein, Dr. Amar Bukhari, and Dr. Sharon Haskins. All of us at St. Peter's Healthcare System are grateful for your leadership and commitment to our Catholic mission. Thank you for all that you do to care for our patients and their families.
As Chief Medical Officer at Atlantic Medical Group, Dr. Scott Lauder is responsible for clinical quality, safety, and clinician engagement and alignment. Most recently, he led the medical group's clinical response to the COVID-19 pandemic. Thanks to his leadership and clinical knowledge, Atlantic Health System was able to successfully test, care for, and educate its communities. Looking back, Dr. Lauder credits this success to his team. I am so impressed with how our team was able to quickly mobilize and rally resources to support our communities, care for ill patients, prevent the spread of the disease, and ensure the health and safety of our patients and team members, he says. Dr. Scott Louder. Thanks to the skill set, empathy, compassion, and leadership of Dr. Nithin Puri, who serves as co-director of Cooper University Hospital's Center for Critical Care Services, the hospital has become a major transfer center in the state with more than 7,000 annual patient transfers from area hospitals. Throughout the pandemic, Dr. Puri actively used his team's collective knowledge, skill, and innovation to save the lives of hundreds of COVID-19 patients who were transferred to Cooper. In addition, he brought together the critical care leadership team with the medical, ICU, and nursing staff to maximize trust and minimize stress. Dr. Nithin Puri. Having originally completed a rotation in Morristown Medical Center's emergency department as a fourth-year medical student, Dr. Louis Rubinson, who now serves as the medical center's chief medical officer, often says he has come full circle. Recognized as an innovative leader and facilitator who develops and implements systems and solutions that optimize care, reduce variability, and promote safety, Dr. Rubinson had established early strategies for the hospital's response to the pandemic long before the first COVID-19 patient was admitted. The most meaningful part of my job is being a part of a broad-based clinical family that continues to innovate care for well-being and health, he says. Dr. Louis Rubinson. It was an unprecedented spring, as Holy Name Medical Center became the epicenter of the pandemic in New Jersey and one of the hardest-hit hospitals in the nation. Clarity was at a premium, and Holy Name's Chief of Infectious Disease, Dr. Suraj K. Sugar, provided that and more. Working 60 days straight and self-quarantining from his family, he evaluated and treated thousands of patients and immersed himself in data from around the world to formulate treatment plans. The son of two physicians who emigrated from India, Dr. Sugar says his proudest achievement is carrying on his family's legacy of practicing medicine. Dr. Suraj K. Sugar. Bringing with him more than 30 years of clinical experience, Dr. Daniel W. Varga joined Hackensack Meridian Health in February of this year as its chief physician executive, just months before the hospital became the center of the COVID-19 epidemic. Immediately taking the lead of HMH's response efforts, Dr. Varga oversaw breakthrough medical care while also ensuring the safety of patients and the hospital's frontline clinicians. Thanks to his extensive knowledge, bold leadership, and passion for healthcare, HMH, which once had more than 2,500 COVID-19 patients in its hospitals at the pandemic's height in April, is now caring for less than 100. Dr. Daniel W. Varga. And last but certainly not least, our Healthcare Professional of the Year category honors individuals in healthcare whose job performance is considered exemplary by patients and peers. Here are this year's honorees. A true advocate for workplace wellness and resilience, Dr. Peter Bolo serves as the Medical Director of Psychiatry at Atlantic Health System. As a physician as well, he understands the unique needs of a healthcare team and as a result combines sincere compassion and empathy with a personal and high-touch approach to build a robust culture of well-being. Even during the height of the pandemic, Dr. Bolo continued to guide the Atlantic Health team to prevail and grow through mental health strategies such as providing virtual support groups, sharing inspirational and supportive videos, and creating tranquil spaces. Dr. Peter Bolo. A practicing internist and primary care physician in northern New Jersey for nearly 30 years, Dr. Stephen Brunquell currently serves as president of Englewood Health Physician Network at Englewood Health. Even with his longevity in the healthcare field, Dr. Brunquell admitted that he had never seen anything like the COVID-19 surge. But that didn't stop him from leading the Englewood Health team and the local medical community through the height of the pandemic. In addition to getting drive-through test sites up and running and working tirelessly to launch a telemedicine program, he consistently provided a calming presence to patients and colleagues. Dr. Stephen Brunquell. According to Samantha Hernandez, being a member of a team that is contributing to something much bigger and making a difference in the world is what makes her job most meaningful. Serving as regional director of the Northeastern Simulation Center at St. Barnabas Medical Center, she has worked diligently to expand the 800 square foot training center to more than 1,200 square feet of space, offering outpatient and inpatient training to the multidisciplinary team and community, along with the media room to record and edit educational videos. During the pandemic, she created a virtual platform in order to continue teaching healthcare providers the skill set needed to effectively serve patients anywhere, at any time. Samantha Hernandez. Since first serving as an intern at Meadow Lakes, a Spring Point community, Dhruti Mehta has grown immensely in her role at the community, officially joining it as the Director of Social Services and recently transitioning to her current role of Director of Resident Services. A face of leadership, Mehta works tireless hours to ensure residents' needs are not only met, but exceeded. When COVID-19 struck New Jersey, she even obtained a temporary certification as a nurse's aide, so if someone needed her, she could provide care. Throughout the pandemic, she was right there assisting with creating protocols, communicating with families and residents, and most of all, providing emotional support to the entire community. Dhruti Mehta. As a pediatrician, Dr. Alyssa Siegel has devoted her career to caring for children. Recently, she became a champion for young adults with intellectual and developmental disabilities as the clinical director of CHOP Specialty Care Center of Princeton at Plainsboro. In this role, she leads a highly motivated multidisciplinary team designed to address the medical and social support needs of patients and their families, all while achieving the center's goal of creating a bridge from pediatric to adult care that can be replicated by other institutions. Throughout the pandemic, Dr. Siegel provided ongoing support to current patients while also accepting new patients. Dr. Alyssa Siegel. Serving as President and Chief Hospital Executive at Hackensack University Medical Center, Mark D. Sparta is leading the hospital in advancing research and innovation and elevating the standard of care. Anticipating an increase in COVID-19 patients after the medical center admitted the state's first COVID-positive patient in the spring, Sparta moved quickly and creatively to ensure the hospital was prepared. He increased bed capacity by redesigning unused patient areas and implemented a direct link to healthcare by using telehealth. Under Sparta's leadership, the hospital is continuously recognized as one of the best hospitals in New Jersey and the nation. Mark D. Sparta. Passionate about providing clinical advocacy to the most vulnerable population in New Jersey, such as residents in nursing homes, psychiatric hospitals, and specialized pediatric centers, Harry Thibodeau serves as President and Chief Operations Officer at PharmaCare Incorporated, a healthcare consulting firm. In March, when the governor and state mandated that there be 3 field hospitals assembled to accommodate the COVID-19 patients being discharged from local hospitals and health systems, Thibodeau immediately jumped to the task of setting up pharmacies at each location and staffing them with diverse teams to provide 24-hour service. Harry Thibodeau.
I am extremely honored to be considered a finalist for the Public Health Hero Award. I just want to dedicate it to all of the individuals with intellectual and developmental disabilities that our agency supports and all of the hardworking DSPs that help support them.
I consider the New Jersey Business Award a true blessing because it validates my lifelong passion to serve others.
It means showing up and doing the work matters. Public health matters.
I am so honored to be able to receive the nomination for Atlantic Medical Group for the training that went on during the COVID pandemic.
An award from among our colleagues in healthcare across New Jersey is quite simply a tremendous honor.
It's the recognition of the strong work done by the team at Capital Health to develop the Robotic Institute of Excellence.
I believe I represent all the nurses that I work with every day, and I certainly would not be in a position to be nominated if it had not been for their support.
This award to me makes me feel proud for the recognition of me and our team at Cooper. Our nurses and our ancillary staff did an unbelievable job. The Cooper leadership was strongly supportive and helped us deal with the crisis.
I appreciate everyone that helped me through this tough time, and I vow to move forward with making sure that our nurses and staff are prepared to care for our patients individually and to make them feel safe and secure in our care.
Really, our successes are based on teamwork and an entire community of delivery of care.
Receiving this award demonstrates that the New Jersey community recognizes the value that teens and young adults with disabilities contribute, and it validates our mission to improve on the care and services that they receive.
I believe that it shows the importance of us giving back to the doctors of the future and allowing them to see what medicine is and what medicine is not.
This recognition by NJBIZ is one of those magical moments really that energizes you to sort of want to do more.
We are honored for this award nomination, but that award is more than that for us. It's just about caring for the residents that we do each and every day, and that's what means the most to us. Our heroes are our staff, and that's what we do here at Meadow Lakes. Thank you, New Jersey Biz.
Thank you, New Jersey Biz.
Wow. That really is such an impressive list of both individuals and organizations. What a great state we live in. Congratulations to you all. But we are not done. Now it's time to recognize the NJBIZ Healthcare Heroes Inaugural Lifetime Achievement Honoree, Commissioner of the New Jersey Department of Health, Judy Persichilli. A former ICU nurse and veteran hospital executive, Persichilli was selected by Governor Phil Murphy to serve as the 22nd Commissioner of the New Jersey Department of Health for the state of New Jersey in 2019 and confirmed by the state Senate on January 9, 2020. Over the past year, she's become a familiar face in the state as the health official running the state's day-to-day battle against COVID-19, the first nurse to ever serve in this leading role, and as someone who understands the challenges of working under pressure, caring for the most critical patients, she has been the calm at the center of the pandemic. Prior to leading the health department, Persichilli served as the acting CEO of University Hospital in Newark, and before that, she was President Emerita of CHE Trinity Health, the health ministry formed in May of 2013 by the consolidation of Catholic Health East and Trinity Health. Having always been drawn to nursing, Persichilli received her nursing diploma from the St. Francis Hospital School of Nursing, a bachelor's degree in nursing from Rutgers University, and a master's degree in administration from Rider University. The recipient of numerous awards throughout her long and successful career in healthcare, Persichilli was inducted into the New Jersey State Nurses Association Hall of Honor in 2006. She also received the Catholic Charities Diocese of Trenton's highest honor when she was awarded the 2008 Richard J. Hughes Humanitarian Award. And it's my honor to now add the NJBIZ Healthcare Heroes Inaugural Lifetime Achievement Award to our long list of accomplishments. Before we hear from Judy, there is someone who would like to say a few words first. Please join me in virtually welcoming the Governor of New Jersey, Phil Murphy.
Hey everybody, Governor Phil Murphy here. It is my distinct honor to join NJBIZ in recognizing the incredible contributions of Commissioner Judy Persichilli over the course of her extraordinary career. This past year, as New Jersey faced and continues to face, I might add, an unprecedented health crisis, the steady leadership from Commissioner Persichilli has been an invaluable resource. I am personally grateful for her guidance as we do our best to shepherd our great state through this unique challenge together. Commissioner Persichilli has been a constant presence at our COVID-19 press briefings, where I have very often welcomed her, like every day, in fact, as the woman who needs no introduction. The truth is that Judy needs no introduction because her reputation precedes her. She is a strong, clear-sighted, and dedicated leader, a highly respected healthcare professional, and above all, she is a warm and caring person who has lived a life of service to others. And she has shown us what so many in the healthcare profession have long known: nurses make incredible leaders. History will remember the role that Judy played in keeping our state safe and healthy during this incredibly dangerous and difficult time. And although we are honoring her tonight for a lifetime of achievement, I look forward to our continued partnership for much more time to come. Congratulations, Judy. You are truly deserving of this incredible honor. God bless you.
Good morning. I've been so fortunate to have a lifetime of working with extraordinary individuals. And in these unprecedented times, when there are so many healthcare heroes in our state who have performed miracles and saved lives despite all the challenges, limited PPE, and no medical playbook on how to treat this novel virus. It is a great honor to be selected as the first recipient of the NJBIZ inaugural Lifetime Achievement Award. Thank you for this recognition. I accept this on behalf of all of the frontline workers and all of the nurses who put their lives in peril to save others. Congratulations to all of the Healthcare Hero finalists. This is a year unlike any other, and that makes your achievements on the front lines much more extraordinary. You are making history as nurses, physicians, public health champions, healthcare innovators, tech pioneers, educators, volunteers. You have all distinguished yourselves, and on behalf of Governor Phil Murphy and the New Jersey Department of Health, the state of New Jersey thanks you. I am privileged to be among you. A Lifetime Achievement Award does make you reflect upon your past, and in my case, we're talking several decades, to where we are today. Like many of you, I began my career on the front lines at the start of my career, and throughout my career, I've also always considered it important to give back, particularly to help residents in New Jersey, the state where I was born in and where I have lived my whole life. I received a nursing diploma from St. Francis Hospital School of Nursing in Trenton and worked as a nurse in the intensive care unit at St. Francis. I then went on to Rutgers College of Nursing and Rider University. Eventually, I returned to St. Francis and served as the CEO. I was then given the opportunity to lead a large national health system. One of the values that I have found most important throughout my professional life is resiliency, and at no time in my career has that skill mattered more than in the past year. When I became the health commissioner just over about a year ago, I knew that I would face challenges, but I never imagined I would be at the governor's side, helping the state through the most challenging public health crisis we have seen in our lifetime. This pandemic required an all-hands-on-deck response that has challenged our economy, our home life, our social lives, like nothing we have ever experienced. And as we all know, it is not over. Many of you have worked around the clock to care for patients and save lives. We would not have gotten through the surge in March and April without the heroism of our healthcare workers, first responders, and certified nurse assistants. We've learned important lessons, including the need to strengthen our public health infrastructure, the workforce, information systems, and agencies to improve our ability to respond to COVID-19 and any future pandemics. We continue to work to ensure there is an extensive network of testing sites and contact tracing, case investigation. We are closely monitoring COVID cases, especially among our young people. And of course, we are preparing for a second wave of the virus in a large-scale vaccination program. I know you all agree with me that teamwork and collaboration are critical to successful leadership, and in particular to combating this virus. So in accepting this Lifetime Achievement Award, I want to acknowledge the team here at the Department of Health who continue to work tirelessly for the residents of New Jersey. And to all the individuals I've worked with side by side throughout my career, thank you. You have all made me look good, and you are all part of my success. I know all of you share my commitment to providing the best quality of care to the individuals we serve. We are not out of the woods yet. We have challenges yet to face. We must continue to remain resilient and work hard, but most importantly, work together. Your resiliency is saving lives. That is the greatest honor anyone can have. I am so proud and humbled by all of you. So please, keep up the good work. And thank you once again to NJBIZ for this recognition.
Congratulations, Judy, and thank you for all that you do every single day to ensure the well-being of all of us that live in the great state of New Jersey. And that concludes our awards. Congratulations to everyone being honored today and to all of the healthcare workers out there. Thank you for your acts of kindness, your innovations, your immense sacrifices during this pandemic, and your continued efforts to improve healthcare in New Jersey. You are all heroes to so many. I'd like to once again thank our presenting sponsor, Horizon Blue Cross Blue Shield of New Jersey, our major sponsors, Hackensack Meridian Health, New Jersey Hospital Association, and Atlantic Health System, our supporting sponsors, RWJ Barnabas Health and St. Joseph's Health, along with our chat sponsor, Englewood Health. I would also like to thank those that contributed with the virtual celebration and all of you that chatted with us during the presentation. Finally, thank you to the entire New Jersey business community for supporting us in these challenging times. It really means so much to all of us at NJBIZ. For over 30 years, we have been the voice of New Jersey business news digitally, in print, in person, and now virtually. We would not be here without you, and I really believe we are all in this together. Be safe, stay healthy, and we will see you again soon. Hopefully very soon.